Yeah, I'm Joe Heiler. I'm the owner of Elite Physical Therapy and Sports Performance. And in this video, I'm going to do a bit of an introduction for functional dry needling. It actually used to be known as trigger point dry needling, and inserting thin filiform needles into trigger points. The needles are the same that they use in acupuncture, but this technically it's not acupuncture. The big difference is in acupuncture they treat along meridians, and there's a map of where they're going to treat, versus in physical therapy where we actually do a very comprehensive evaluation, some movement-based testing, a lot of palpation to find trigger points that are creating pain, possibly creating referral of pain into different areas of the body, and then we specifically treat those points. So the idea with using the needle to get into the trigger point is we want to create what they call local twitch response, where you get the muscle to kind of reflexively fire, and then what happens is that muscle, it relaxes, it decreases in tone, and a lot of times you get a big decrease in pain when that happens. You can also get an increase in range of motion or flexibility as the muscle is going to elongate better. Many times we even get an improvement in neuromuscular control of the muscle. So in other words, it turns on with better timing, or it relaxes much quicker with better timing. And the overall goal with any type of manual therapy, and especially with the dry needling, is just to improve function. So getting people back to walking or getting back to their sports without any kinds of limitations. So, and the dry needling is a great way to really get at the muscle, intramuscularly, versus the other forms of therapy we have, which are just treating everything superficially. So to this point, functional dry needling has been very beneficial to our practice, and getting some great outcomes much quicker than we normally would. So what I'm going to do, I'm going to demonstrate, everyone come on over, I'm going to demonstrate how this would work on the upper trapezius muscle. Let me turn your head just a little more left. So what a trigger point is, it's a band of hyper-irritable muscle, and everybody has them. And if it's an inactive trigger point, or what we call latent trigger point, it'll just be tender where I'm grasping it. But what many people have are what we call active trigger points, and when I grasp the trigger point, specifically this one closer to the neck, many people will get referral into the neck, or even up and around like a headache, what they'll call a ram's horn headache. The trigger point that's a little more distal toward the shoulder out here, many times we'll refer pain into the shoulder and down even into the shoulder blade. So when it does that, we definitely know it's an area that we want to treat. And so what we're going to do, I palpate the trigger point, kind of to pull it away from the rest of the body. The needle just sits in a little tube, which I just press down on in, and then I'm going to tap the needle right into that upper trap. So it's already in, and most people don't even feel that part. And then I'm going to just slowly kind of move that needle in and out of the trigger point. We're looking for the muscle to jump. Hopefully you can see that on the video. You can get 3 or 4 good twitches out of the muscle, and then the needle gets taken out, and that's pretty much all there is to it.